Dear students, welcome back. In the previous session we have discussed about low frequency currents. Now in this session we are going to discuss about medium frequency currents. These currents have between a frequency from 1 kilohertz to 10 kilohertz or 1000 hertz and 10,000 hertz, and or either amplitude modulated. These are either amplitude modulated, that is interferential currents, or time modulated. So it is of two types, the medium frequency currents. One is amplitude modulated, that is interferential currents, or time modulated type medium frequency currents called as Russian currents, which are used for muscle contraction and pain relief. So now we will see first the interferential currents. So these are the interferential currents, and here you can see this pic in yellow box. So this is the procedure of production of interferential currents. Okay, now we will see. So this is the most popular form of electrical stimulation used in clinical practice, and this current, as name suggests, it is produced from the interference of two medium frequency alternating kilohertz containing intensity of constant intensity. The currents applied through two pairs of electrodes have a slightly different frequencies. For example, one pair will have 5000 kilohertz, okay, and another one is having 4950 hertz. Okay, both are medium frequency only, but it is having only slight different frequencies. Okay, and these frequencies will get intersect deep in the tissues. So the current reinforces in the central region of intersection to produce stimulus waveform that is sinusoidally modulated at a frequency equal to difference between two alternating frequencies called as beat frequency. So one pair that is will have 5000 hertz, and another pair, so these called as quadripolar. We have to arrange in opposite directions. Okay, so if you take A group and you can keep it in positions, okay, oppositely. Okay, this one in one side and another one you can take in opposite direction, and at the center, at the deeper tissues, inside the deeper tissues, it creates what you called as this intersection creates a waveform that is sinusoidally modulated at a frequency equal to difference between these two medium frequency waves. So that one is called as beat frequency. So the stimulation waveform would have a modulation frequency of 50 hertz we will get. Okay. So the resulting current, which is amplitude and frequency modulated, would oscillate at a carrier frequency of 4975 hertz with burst beats. So you can see in another thing. So this is the another example. Okay, burst beats. At the point of intersection, a greater total intensity, that is sum of two currents, is produced, that is amplitude modulation. at depth in the tissues, producing maximum stimulation. Okay, so here you will have the circuit 1 and circuit 2 of different modulations. These two give interference. So how the interference is going to take place means this 5000 Hz waves and this 4950, these two waves are going to form a sinusoidal waveform. Okay, and it is getting the frequency of 50 Hz. 50 Hz beat frequency is obtained here. Okay, and the carrier frequency we will get here is 4975. Okay, 4975 Hz we will get. Yes, this is called as amplitude modulation. The rationale for using currents in the kilohertz frequency range is related to the role of skin as the capacitive barrier to the flow of current. And with increased current frequency as applied in interferential therapy, skin may offer progressively lower impedance, allowing electrical energy to dissipate peripherally and more electrical energy to penetrate to muscle. Hence the muscle gets more energy at lower frequency, that is beat frequency. Okay, so this is the thing happened in the interferential therapy. So such kind is normally used for pain relief. Okay, and also it can be used in muscle contraction also sometimes. Okay, mainly the pain is getting relieved with this interferential currents. Okay, next we will move on to the next type of current, that is Russian currents. Now we will see the Russian currents. So this current was developed by Russian scientist Yakov Korts for increasing muscle force that increases the maximum voluntary contraction. Okay, Russian currents are alternating currents. So here you can find very clearly these are alternating currents at a frequency of 2.5 kilohertz or 2500 Hz, burst modulated at a frequency of 50 Hz. So for every 50 Hz, so here you'll have a burst modulation. Okay, and with a 50% duty cycle, the burst duration is here 10 milliseconds at 50 Hz. So for this 50 Hz time duration is 10 milliseconds, and also for the next if you see this next duration, that means next starting of this 50 Hz, it will take another 10 milliseconds. Afterwards again the Russian currents will start. Okay, so there is a less possibility of tissue damage in this type of currents, though its physiological effects are very much least understood. Its use is well admired, so well we can appreciate their physiological effects as a muscle strengthening modality. So the Russian currents we can use in muscle strengthening modality. Particularly such currents are used in athletes. Okay, here this is the waveform of the Russian currents. So these are all about this medium frequency currents. Whereas if you see in the high frequency currents, these currents with a frequency greater than 10,000 Hz, which are unsuitable for muscle and nerve stimulation, thereby used for the production of heat. So that current is used in therapeutics in the application of shortwave diathermy, microwave diathermy, and to produce ultrasound. So those are high frequency currents. They are not used, they are unsuitable for muscle and nerve stimulations. So because they are higher frequency waves, we can call it as, so this will produce more radiation. That means it is used for the production of heat. Okay, so this is all about the therapeutic currents. In the next session, we are going to discuss about direct current for the treatment of patients. Thank you.